The Wellness Hour. An in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Hot topic today, what you need to know about breast surgery. Not all doctors are approaching breast enhancement, breast lifting the same. With us, we have an expert on the topic, Dr. George Brennan. Dr. Brennan, welcome to the program.
Thank you very much.
Always a pleasure to have you on the show.
Thank you.
I think for people that don't know you, I mean, you have medical texts written for doctors. Is that right?
That's exactly right.
Tell me about this book. What this is written for doctors?
That's a textbook that is for the professional sector, and it's for doctors, and it's a very technical book. It's not for the lay public.
Now you also have another one for the public. Tell me about this one. What is this?
This is a book that we recently wrote, and it deals with the idea of creating beauty.
Okay.
And it talks about the industry of cosmetic surgery and the beauty industry.
They can order this book online. I want to make sure the cameras pick up on this.
People can order that book online and on Amazon.com.
It's very interesting, by the way. I mean, I've learned a lot because even though I interview a lot of plastic surgeons and doctors, you have stronger opinions than most. And also your results are better than most.
Thank you.
So that's good. So today we've invited you on the show to talk about breast surgery. First, tell me about your practice, because you don't just do breasts.
No. In fact, I've limited my practice to cosmetic surgery from day one. And we do, in our clinic, we do cosmetic surgery literally from head to toe. And so we start with treatment of baldness. We do all types of...
Really? So you do hair implant surgery, or...?
Yes,
okay.
Yeah. And both in men and in women.
Okay.
All right, and then we have two basic objectives. One is to create beauty, so where we're changing the basic shape of a face or a body to make it more attractive.
All right.
And then the other concept is to maintain beauty and to do rejuvenative surgery.
And they do this in your, I guess you have the Hot Surgery Center in Newport Beach.
Well,
is that right? What's the name of it? It goes into your name, or what?
No, it's called the Newport Beach Center for Surgery. And this is a multi-specialty, fully accredited outpatient surgery center. And so in our clinic, we have a group of doctors from a variety of specialties, and so that we all work collectively as a team with a common goal of making a person look better, literally from head to toe.
Now, you've been doing this a long time. I should mention for people watching this, former, past president of the American Board of Facial Plastic Surgery.
True.
And you're also head of the Facial Plastic Surgery Foundation.
Yes.
You get together and share ideas every year with your feisty beliefs sometimes.
Yes.
Is that
Yes.
right?
Yes.
Yeah.
And every year we have a meeting, typically in Newport Beach, where we invite doctors literally from all over the world, and we have and from different specialties.
Okay.
So that we have cross-fertilization of ideas.
Are you at the top of your game right now? I mean, do you feel that way? Like you're better now than ever as far as facelifting, breast surgery, whatever?
Yeah.
You do?
In my mind, I'm as good as I've ever been, and I will match my results with anybody
With
in the
anyone.
world.
Okay, breast surgery, big topic. You brought a lot of things today. I'll let you start wherever you want. Give me the different categories of things you want to talk about today.
Well, first of all, I think that we already mentioned that we do our surgery in a fully accredited outpatient facility.
Okay.
And that is very, very important. And our credo is patient safety.
All right.
And so the patient then has an option of coming in and doing outpatient surgery and going home that same day, or we have an overnight facility.
Very nice.
So the patient has an option.
Better than the Four Seasons.
Better, yes.
I know we invited you to talk about breast, but I saw those photos with the body lifting things you're doing. I'd like you to show those and explain what you're doing there.
Well, some people lose a significant amount of weight, and
there's a lot of bariatric surgery out there.
A lot, and it's becoming more and more popular. But when people lose 150 pounds, they have a tremendous amount of extra skin.
So it's almost like a tummy tuck for the leg. Is that what this is,
in
a way?
So you can well imagine how happy that person is. And so that's just one of the components of body contouring. And so, and I know we're here today to talk
about
specifically about breasts, all right? And I think what what the audience needs to know is that breast surgery is not only for women, it's for men as well.
Okay.
Because
I got to hear this one, Doctor.
All right. Because some men are born with what we call gynecomastia, which means that they're born with a female type breast. Okay. And so we're able to reverse that and get dramatic results.
All right.
Some people are overweight and they need to have a breast reduction, men. And then there are some men who simply haven't developed good muscles.
All right.
And so they want to have breast implants.
Really? You got to be kidding. So men are getting breast implants.
And here's a perfect example of a man.
Wow, it's subtle.
Who had a breast implant, and there's no question that he has more defined pecs and feels better about his physical being. And so there are various things that we do for women, and one is to make their breasts larger. Sometimes women's breasts fall, and so we want to lift them. Sometimes they're born with excessively large breasts, and they want to reduce them. And so, and so they have different clinical conditions that have to be treated differently.
Okay. Now, by the way, if anybody's tuning in, especially because a lot of people know about breast augmentation, or they think they know, and I've interviewed hundreds of doctors on breast augmentation. But if you have breast augmentation or considering it, you got to hear this. This is a different take than I've ever heard. About what you're about to say as far as creating a natural breast. And there's others, that agree with what you're saying. But this makes absolute logical sense. So, I'm sorry to interrupt. Go ahead.
All right. Well, we have a certain philosophy about how breast augmentation should be performed.
Okay.
And number one is when a patient makes an appointment, we ask them to bring in their dream bra.
Okay.
Right? And so for example, they come in with a bra, and then we show them a variety of implants that they can choose. And basically, there are two types of implants. One is an inflatable balloon that we fill with salt water.
When you say salt water, we're talking about saline.
Saline.
Okay, good.
Okay, but the key is during the consultation, is to educate the patient and give the patient different options.
Okay.
And basically what we're trying to get the patient to do is to make 4 decisions. Number 1, where should the incision be placed? Number 2, what is the size that that patient desires? Because the doctor should not, in my opinion, should not dictate how large a patient should be.
Does that go on?
All the time.
All the time,
yes.
Okay.
In fact, I would say that in the majority of instances, the doctor decides how large the patient wants to be.
But how am I going to know what an implant's going to look like? I mean, isn't that really?
Well, the way they do it is
with the bra. So that's accurate then. That's pretty accurate.
Absolutely. So they put their dream bra on, and then they try a variety of implants, and they decide for themselves the best size to suit them.
So they come in thinking they know what size. Sometimes.
Sometimes. All right, but
and then they say, "Oh my goodness, that's too big."
Exactly. And so when they try their dream bra on, what we do is we try a certain size implant on one side and another size on the other side, and then they.
So these right here, what we're looking at, this is just how big is this? What size is this?
That's a 400 cc.
So 400, okay, and then they just go down. I can read it there, 375, and that's.
No, these are all the same size, but this happens to be what we call a low profile.
That's a 375, that's a 375?
And this is a 375.
Okay,
but
interesting.
This is a medium profile, and this is a high profile.
So they're all 375s, but they look, because you can't see it at home, these all look different.
Exactly.
Okay.
And this is wider and lower, and this is more narrow and higher, and this is even more narrow.
But doesn't everybody want height, that projection?
Some
like
do.
Everybody wants
Some
the middle
do, and it depends on their basic stature.
Okay.
And some people have a very petite frame, and they want a lower profile. Some people want to have excess projection, and so this is a more ideal.
Okay.
But the key is that during the consultation, they can try these implants, and they can try the saline-filled implants, or they can try the silicone-filled implants.
Much better.
Okay. well, to me,
I mean, that feels like a water balloon. This is like flesh.
Exactly. There's no
Very
question,
nice.
no question about it. Okay, and the other thing that you should see is this: is that you see with a saline implant, you can see this scalloping.
The creases.
The scalloping. See?
Interesting.
All right. Well, with a silicone implant, you see a very smooth surface. You never see scalloping.
Nice.
Okay? All right, and so that's just another factor. But the point is that the patient has a preview of coming attractions, and they're the one.
So you do like full disclosure then? I mean, you let them know all?
Full disclosure.
Okay.
The concept in our mind of a consultation is to educate the patient, give them their options, make them intelligent about all of their choices, and then they decide. Because then that way they can control their own destiny. Okay.
Okay. And now with the gel filled, you call them gel filled or you call them silicone? Same thing?
Well, it's the same thing. Yeah, there are basically two types. One is the saline, and the other is the pre-filled silicone implants. And this is a gel filled implant. And
same thing. Those have high profile.
Right. In fact, here's the low profile, the medium profile, and the high profile. And then here is a 300 or a 10-ounce implant. And then this is a 400, which is like about a 13-ounce implant, and this is a 500, and this is a 600.
Oh boy!
So the patient can try all of these implants. All right. Now the other factor is this: is you can see that this has a very smooth shell.
Yes.
Okay. Now there is a thing known as a textured implant. Okay, and this is a textured implant.
What's the benefit there?
Well, if you can just feel the two of them.
Yeah.
You see, this is a much harder implant. So
who would want that then?
Okay, well, some patients have been taught that if they use a textured implant, that they have less chance of having a hard breast.
Like scarring?
Scarring.
Is that true?
It is not true. Scientifically, it is not true. And this is not as natural feeling an implant as this.
But you offer just in case, no matter what, they're very stubborn, they want it, you offer it.
We give them every option, and then it's
But you tell
it's up to
them that there's no proof that that is going to cause any less scarring or anything. There
is no scientific evidence
to
prove that that's going to stay.
Good.
Now, what's also important is that whenever we use an implant, whether it is a cheek implant, a chin implant, a breast implant, a hip implant, your body, by nature, will develop a protective scar tissue barrier around the implant.
Okay.
And so that will happen
no matter what you do.
No matter what you do, no matter what kind of breast implant you use. All right? Now, usually, that scar tissue barrier is what we call a capsule. Usually, that stays paper thin, and the person doesn't detect that they have an implant.
Okay.
But the kicker is that we cannot predict what nature is going to determine.
You say though that it's a very low percentage overall, especially in your hands or in your case of this. You call it capsular contracture. Did I say it right? Okay.
Which is basically a scar tissue. Now the good news is that in the event, in the off chance that happens, it's easy to take the patient back to surgery and release the scar tissue, and the patient has a.
Is that a big percentage of your patients? Patients that have hard breast, they come in and get it redone.
Very, very small percentage. It's in the order of 1 or 2%.
Why don't they all do it though? Because there are women out there. We get emails on wellnesshour.com that say, "Who do I go to? What should I do?"
They're probably not aware. You know, they don't realize that there's a very simple solution to that problem.
And you could take it out, and but it'll probably happen again, won't it?
Well, no, because the problem is the breast doesn't get hard, nor does the implant. It's the scar tissue that surrounds the implant.
Okay.
And so if you release the scar tissue, you give the implant
Soften it up.
a bigger house to live in, and it stays soft.
I know you brought some photos, and we're going to have to take a quick break, and we're just about out of time, but what are you showing us?
All right. Well, first of all, here's a patient who does have that scar tissue and is an ideal candidate to release the scar tissue.
It's very high breast.
It's a
Is that
very
what I'm looking at there?
It's a very high breast, okay? And now here we have her flexing her muscle, and you see this big gap and there's
No cleavage at all.
Yeah, excessive cleavage.
But isn't it true
All
you can't do much about cleavage?
No, and I'd love to get onto that subject.
I mean, we have
because-
doctors on the show, plastic surgeons, say,
Yeah.
Randy, you really, it's genetics, it's how you're born, it's Mother Nature, and you say, no, that's not
No,
true.
that's
You
not
can
true.
create cleavage.
No,
Okay.
and we're going to get onto the subject of the muscle and whether these implants should be placed under or over the muscle, and I'm going to show you something that's compelling.
Okay, now if you're just tuning in, we're here with Dr. Brennan, world-renowned facial plastic surgeon, and we're talking about cleavage. He has an approach that literally I've never heard before until today, and I've interviewed thousands of guys, so go ahead.
All right, well, you can see that
No cleavage.
she has excess cleavage, all right?
Yeah.
And that's because her implants are under the muscle. After we place the implant over the muscle,
Huge difference.
yeah,
Look at the cleavage.
She has a far more natural appearance.
My doctors will say that are on the show, the guys that are going over the muscle, it's just an easier procedure, so that's why they do it. They want to get on the golf course, so they go over the muscle. What's your response to that?
That is absolutely false. And
So over the muscle is better result as well?
over the muscle
Okay,
is so much more natural, because if you ask any woman to touch their breast and flex their muscle, they'll tell you that their breast tissue is by nature over the muscle.
All right, now that makes
so
sense.
the idea of putting an implant under the muscle, to me, is totally contradictory.
Isn't it designed, though, because you get less of that hardening of the breast or scar tissue or capsular contraction?
No, that is another misconception, because
But is that being said by other surgeons?
it is being said.
Do you guys
by the
argue about
surgeons.
this at these national meetings?
Yes, we have our national meeting of the American Society of Cosmetic Breast Surgery, where we debate this every single year. And
But these are just flat out better results. Women want cleavage. They obviously want bigger breasts sometimes,
yeah,
but they want cleavage. And
they want cleavage, but they want a natural, beautiful looking breast.
All right.
And if you put the implant under the muscle, you're not going to get that. And I'd like to show you
All
some
right,
examples.
okay, this is
All right?
this is interesting.
Now, look at this patient. Now, this is not my patient, but you see the wide cleavage that she has. Do you see where that nipple is?
Yeah.
Okay. Nipples belong in the middle of a breast, not out here looking at
Not
Mars.
to the side. Okay.
All right. All right, now here's another example. This patient is under the muscle. She's a bodybuilder. When she makes a muscle, she gets that type of deformity.
Wow.
Okay? That to me is not attractive. It's
But who
not-
makes muscles like that?
Women make muscles like that
So if they're
every
picking something up?
every time they lift something. If they're working out, I could take you to any local gym and I can show you patients who are working out,
Okay.
and the ones who are under the muscle, their breasts are going every which way.
Okay,
Right?
okay.
But a natural breast in a woman does not move.
So by going under the muscle, if you lift, it gives an unusual lift, and they create this high breast. Is that what you're saying?
It can.
Okay.
And all right, now, if I can show you another example.
All right.
Here's a patient where when she flexes her muscle, the right breast looks this way,
Gee.
and the left breast looks that way. Okay, again, not ideal. All right, now.
All because they went under the muscle.
Under the muscle. The muscle is sort of like the lapel on my jacket.
Okay.
All right, and if you can pretend that the muscle is like if my tie is the breastbone, the muscle is attached to the breastbone. So if I want to put an implant under the muscle, I can't get to the midline.
So you can't create cleavage.
And create cleavage.
Interesting.
That's exactly right.
Okay.
See, but if I go, because it's attached, right? Now, if I go over the muscle, I can get right to the
Cleavage.
midline and give you beautiful cleavage.
This
You
is
see?
unbelievable.
All right.
I'm not trying to endorse you, but this does make sense.
Yeah,
but so many doctors come on the show and tell me, Randy, you can't do anything about cleavage. Really?
That's false.
not true.
That's false.
Wow.
Okay. Now, here's.
But do you have to dig in a little bit? I mean, do you have to create a little bit of a pocket sometimes if it's too far apart?
No, because it's, by nature, that's where the breast is. So you can get right over to the midline if you go over the muscle.
All right, all
If
right.
you go under the muscle, you're restricted.
And you say half of the implant or part of the implant, like your lapel, is hanging underneath the muscle
Exactly. In
on
fact,
every under the muscle procedure.
without a doubt. Now, here's a perfect example of what you're saying. Do you see this crease in this patient's breast?
Wow, on the right and left.
This is what we call a double bubble deformity, and that's because the lower part of the muscle is indenting the implant. Okay? Now, let me show you this photograph.
So this is the risk of going under the muscle. I mean, this is what you want people to know.
Absolutely.
Okay.
Yeah, going under the muscle creates a very unnatural.
You don't like
it? I hate it.
I mean, if you legally could stop it nationwide, you would say no more.
That would be my opinion.
Okay,
Yeah.
good.
All right, now, let's look anatomically.
Oh, this is interesting.
Here's the muscle. If you notice, the lower part of the breast is below the muscle. Some people think that if you go under the muscle somehow supports the implant, which is not true, because the lower part of the implant is hanging free under the muscle.
So why are they doing it?
Well,
give me the inside scoop. Give us all the inside scoop.
All right. The doctors that go under the muscle, first of all, that's how they were trained. All right, and if you try to talk to them scientifically, they'll tell you that the patients have less of a chance of having hard scar tissue.
And that's not true
if
either.
Under the muscle.
Not one study can prove that.
There is no scientific study that will support that premise.
But more importantly, though, a better natural look over the muscle.
Without a doubt.
What if they tell me this, by the way? Because I knew you were going to talk about this, and I came up with questions from asking people that over the muscle you get these striations. It shows the implant if you go over the muscle.
That is not true. Unless you have a patient who...
Is that only in the case of saline, maybe? Or no?
Well, you can get rippling, and I have already shown you the scalloping you can get from having saline implants. But if you use silicone implants, you have less of that factor.
Okay, we're going to take a quick break. We come back, we'll show those photos. You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. We're discussing advances in breast surgery. We'll be right back.
Tried all sorts of cover-ups for bad breath? Try the science of BreatherX. Only BreatherX has Zytex. It attacks the cause of bad breath, keeps working for hours. It's clinically proven for real fresh breath.
Get non-prescription BreatherX from your dental hygienist and now at fine stores everywhere.
Designs for Health is the nutritional supplement brand of choice, exclusively recommended by healthcare professionals.
As a physician, I insist on the science-first approach of Designs for Health. They have synergistic formulations with optimum quantities of therapeutic nutrients.
Designs for Health, the leader in professional brand nutritional supplements.
Hi, I'm Randy Alvarez. You're watching The Wellness Hour, leader in medical news and information. We're here with Dr. Brennan, and we're discussing really a different philosophy of how to create a natural-looking breast. Okay, Dr. Brennan, you have some more photos.
Here's what I'd like to show you. Here is a patient who simply by nature was underdeveloped. Right? Now, you can see how natural that result is. That is an implant over the muscle. Beautiful cleavage, symmetry. You would never know that she had an implant. Okay.
Very natural. Okay.
Right, very natural.
What about incisions? Where are you hiding the incisions?
All right. Now, the incision is also very important because wherever you make an incision, you could heal with a scar. So if you make an incision on the front of the breast and you happen...
The nipple area. Around
the nipple area.
Okay.
And you happen to scar, and honestly, you're playing, it's like playing Russian roulette. And you never know.
You don't like going through the nipple area?
No.
Well, I mean, it's the most beautiful part of the breast. I've always argued this with plastic surgeons. Help me understand why you want to go through the nipple because it's so dangerous. They say, well, because the scars show everywhere else.
But that isn't true.
And you have more control of the pocket, they always say.
Well, but see, that isn't true because if you show me where the scar is on that patient.
You can't see it. So it's in the fold.
It's in the fold.
But what about
underneath.
when they pick up their arms?
Right. Well, if you make an incision in the armpit and you happen to scar there, then it's visible every time you raise your arm.
So if you're, for the most part, not a non-scarring person, then no matter where you put it, it's not a big deal. But the nipple, no matter what, will show some kind of a line. Is that right?
Without a doubt.
So you might as well put it in the crease.
That, in our opinion, our strong opinion is that the incision should go in the crease. That's where it's best hit.
No truth about that. You just have more control by going through the nipple area.
No, in fact, if you go through the nipple area, then you're actually going through the breast tissue, which again, in my mind, is not smart. It's better to go in the crease underneath the breast, because then you have never violated the breast tissue. You're always in between the breast and the muscle.
Very interesting.
Which anatomically and by nature is where the breast is.
Okay.
All right. Now, just another example of a patient who was underdeveloped and wanted to have larger, more attractive
Over the
breasts.
muscle, you can't see any incisions?
If you can see it,
These aren't touched up photos?
These are not touched up.
Dr. Brennan, okay, okay.
Yeah, but if you can see a scar there, you show it to me.
Okay,
All right,
can't see it.
Now, the other category of patients that we operate on.
And we are running out of time, so I'll ask you respectfully to rush through this.
Okay, now I'm going to show you two other categories of patients that are ideal candidates for breast implants. One is the person who nursed and who has lost the volume to the top of her breasts.
Okay.
All right, and by using an implant, you can not only replenish that volume, but you also get a breast lift.
Okay.
Now here's another one. See, this patient lost tremendous amount of volume of her breast. Very often, these patients also have loose skin of their belly. And so by doing a combination of a belly procedure and a breast implant, it's what we call the mommy makeover.
All right.
So these patients get tremendous improvement in the shape of their body.
That is a big difference.
Okay, now the final example I want to show you is one where sometimes patients feel their breasts are too large. And through a very simple procedure now called liposuction, we're able to do a breast reduction.
So liposuctioning the breast in a
Lipo,
reduction.
yeah, the logical thing, because the breast primarily is fatty tissue. Now, in years past, to do a breast reduction was a major procedure with a lot of complications. And today, it's a very, very simple procedure.
Final message to anyone out there that has more questions. You meet with everybody one-on-one. They call your office.
They call the office, make your consultation. They'll come and see me. We'll have a heart-to-heart, one-on-one. We will educate them totally. They're free to ask any questions whatsoever.
Okay.
And then they make the intelligent decisions for themselves.
I spoke to a very prominent woman from Newport Beach in the know, in the industry. She said, Dr. Brennan is the go-to guy, and this is an exact quote, for a natural-looking breast. So, well, good for you. So I want to thank you for coming on the show.
Randy, it's my
and
pleasure,
we'll have you back again. You've been watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. If you would like to see this interview again online with Dr. Brennan, you could just visit our website at wellnesshour.com and type in breast surgery or breast augmentation. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.